Hi, Sally Walker here, your hormone and slow age expert. So can we diagnose, can we test for perimenopause? Well, I suppose the clinical or the medical answer is not really, no. But I find in my work that it's the symptoms that indicate the perimenopause more so than testing. So blood testing, urine testing, saliva testing is not really going to be that helpful. And this is one of the reasons is that every cycle is different. So there is no sort of classic picture. Like with the boys, it's much easier with the boys because there is only one hormone, it's testosterone, and the levels of testosterone start declining. Testicle production of testosterone start declining from about the age of 30. So the testosterone levels through decades can be recorded, registered for boys, so they get an idea of where they are in their production of testosterone. But we can't do this with us because we ladies, we've got two hormones, estrogen, progesterone, even testosterone for that matter. And we have these 28-day cycles. So our hormone levels are all over the place anyway, and then they become very much affected by the menopausal run-up or the perimenopausal years. But every cycle is different. So there is not really a test until you're getting closer and closer to your menopause stop. Okay, so I find symptoms to be one of the best indicators, and there are specific symptoms which would indicate that progesterone is low and out of balance, and there are other symptoms which would suggest that estrogen are. So be sure to check out all those symptoms in this blog to help guide yourself as to which one it is. So just to give you a sort of a heads up, then in the early part of your perimenopause is probably going to be progesterone that needs to be supported. This is what I see mostly with ladies, and you can support it in your cycles. So progesterone is typically produced from around day 14 to day 28. So you can support progesterone there and ease some of those perimenopausal symptoms. As you come later or approaching the menopause, then it may be estrogen that needs to be supporting as well to take some of the other symptoms or lessen some of the other symptoms. So symptoms are a good way. But you know, if you wanted to do blood and urine testing, that kind of thing, so blood testing, you could test a hormone called follicle stimulating hormone, FSH, which is produced in the pituitary and sent to the ovaries, stimulating the ovaries to get an egg ready and start producing estrogen. So as that level increases, so as your FSH increases, it is indicating the ovaries are not functioning as well as they should do. But as I said, it's normally late in the perimenopausal run-up that the FSH begins to increase. So, but it is the way you could, or this is the way the doctor would test to see if you were perimenopause. So you could also test estrogen, but as I said, testing estrogen, when are you going to test it in the cycle? We know when it should be at its highest, that's around ovulation, just before ovulation. We know it peaks again around day 19 to 22, not as high as just before ovulation, but we know it peaks there. Do you want to test it there, or do you want to test it at other times? And how can you compare this with what it was before you were perimenopausal? So if you have no knowledge of your estrogen levels, then testing the estradiol, which will be the estrogen tested in blood, might not make any sense at all. And again, you'll probably see the low levels first as you're getting very close to the end of your perimenopausal times. But you could also test AMH, so anti-Müllerian hormone, which will give an indication of how many eggs you have left. That could be another thing to do. This is typically done when ladies are having difficulties getting pregnant, so fertility clinics will typically measure this one. You could also test progesterone. It's not very often tested in blood. It's better to be maybe tested in urine. You definitely want to be testing between day 19 and 22 in your cycle, because this is where we would see very high levels of progesterone. So if it's low, it will just tell you that that particular month there was no ovulation, but it's not any guarantee there won't be one next month or the month after while you're in this perimenopausal time. So it is challenging. So a lot of docs will say, no, we do not test for perimenopause, and they're not just being difficult here. They're actually telling you the truth. It's not really a test that we can use at the moment to give a clear indication. So symptoms tend to be the best way forward. Anyway, have a little look at the symptoms for low progesterone, the symptoms for low estrogen, the symptoms for estrogen dominance and all this kind of thing. And maybe you can discover where you are. Happy hormones, happy life.